So by my accounts, it's 1 p.m. Australian Eastern Daylight Time, so we'll get things going. So hello and welcome to the second of Comcare's Psychosocial Health and Safety Forums for 2024. I'm Andrew Crane, Director of Comcare's Education and Engagement team, and I'll be your host for today's event. If you've joined us and watched one of our previous forums, welcome back. And if this is your first one you've attended, it's great to have you with us. You can view our previous psychosocial health and safety forums and related resources from links that are on Comcare's website or via our YouTube channel. And throughout the sessions, we're going to have a few poll questions, and the first one should hopefully be going up now, which is in 1 or 2 words, if you can tell us what you're hoping to get out of today's forum. If you don't have access to the poll because of security systems in your system, feel free to use the chat and post your response in there as well. So great to see people already engaging there. Now, firstly, on behalf of Comcare, I'd like to acknowledge traditional custodians of the lands on which we're all virtually meeting today. I'm joining you from Canberra, so I'd like to acknowledge the Ngunnawal people who are traditional custodians of the lands that I'm grateful to be on. And I'd like to pay my respects to elders past, present, and acknowledge the contribution that they've made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander people who are present and joining us today. So a little bit of housekeeping. The session is being recorded, which will be made available along with the presentation slides and any relevant resources in the coming days. And this means that your microphone and camera will be remaining off by default. However, we have enabled the chat function for you to participate and engage in the conversation. Of course, we ask that you please keep all the comments safe, respectful, and on topic. And as I mentioned, we'll be using a few top polls during the forums for you to participate in, and that is if your local settings and controls allow for this. And great to see that engagement, that we've got people who are keen to see engagement, increased knowledge, have greater understanding. That's excellent to see. And hopefully we're going to meet the mark for you there. Now, if you are using the Microsoft Teams application and currently receive chat notifications audibly, there's some instructions on the screen how to turn those off if you'd like to reduce those as a distraction. And the forum today will be discussing a range of psychosocial hazards and their impacts. So if any of the content of the discussion today triggers some significant distress or highlights the need for some support, please take action. Today's World Mental Health Day, and so there's no better time to reach out and access some support, be that from a friend, family, peer, or a professional support network. There's some links and contact numbers to nationally available support services that have also just been posted in the chat. Also, before we begin, I want to acknowledge the range of questions that were submitted by you as the audience. So a lot of you during registration put in questions, and they're really helpful in shaping the content. We also will look to put some of those questions to our presenters during the Q&A time as time allows. So, Safe Work Month. You might already be familiar with National Safe Work Month, which is held annually during October each year, which aims to raise awareness and enable discussion about work health and safety. In 2024, it's the 15th year for this initiative, which is driven by Safe Work Australia, and it's supported by work health and safety jurisdictions across the nation, including Comcare. The theme for this year's Safe Work Month is Safety is Everyone's Business, which encourages all of us to prioritise safety in our workplaces and work towards reducing the number of work-related injuries and illnesses and fatalities. It'd be great to know a bit more about you as an audience and which work health safety jurisdiction you're in. So there's another poll that's up there which asks, who is your work health safety regulator? So please let us know which jurisdiction you're in, because we know that it's likely going to be some diversity in there, which is great. And I can already see that from the initial responses, we've got about 60% are from Comcare, which is great. And we've got a range of other jurisdictions which are being represented as well. So it's terrific to have you all here. So Now, to get us officially started today, I'd like to introduce Comcare's Chief Executive Officer, Greg Vines, to give us a short welcome and formally open the forum. Greg, thanks for joining us, and over to you.
Many thanks, Andrew, and good afternoon and welcome to everyone who's joining. It's fantastic to see so many of you online this afternoon. And for those of you who are attending one of our events for the first time, thanks very much for joining us, and I hope you get a lot out of today. I noticed that the first poll that Andrew put up was asking what you want to get out of today, and overwhelmingly it was information, and we've got plenty of that, so I hope we're hitting the mark with what it is you need to know. For those of you who have been with us before, thanks very much and welcome back. But also just to make the point that we really do take on board the feedback, the questions that you send in, and it's really important in helping us shape this event. So again, welcome to you all. I'm in our Sydney office today, so I'd like to acknowledge the Gadigal people of the Eora Nation as the traditional custodians of this land that I'm on. And I pay respect to their elders past and present, and also extend that respect to any Aboriginal and Torres Strait Islander people who are taking part in this event today. And I'm in Sydney today I spoke earlier at ACTU Healthy Work Forum. So it's good to see that our partners, HSRs, union representatives, are also working with us and other regulators to really bring a focus to National Safe Work Month, which of course is held every October. And today is our first of several events that we'll be holding throughout the month. We've always been a very strong supporter of Safe Work Month, and I think the program of online events we've got scheduled for this year as well, this month as well, will be of interest to many of you. Indeed, our next event is just in a couple of weeks' time on the 23rd of October, and it's a very special forum. The first time we've held a special forum for health and safety representatives, and this one will focus on recent changes to work health and safety laws and the role of HSRs in identifying and managing psychosocial hazards, a massively important issue for all of us. And then our final webinar will be the Transport Network Forum on the 30th of October. And this recognises that transport and logistics are strongly represented across our scheme, the Comcare scheme, and it's a great opportunity for industry experts and peers to share the latest information and initiatives in risk management, prevention, and of course, early intervention. It is no coincidence that today's forum falls on such an important date internationally, and that is World Mental Health Day. And that's a global campaign to raise awareness of mental health. For 2024, the World Mental Health Day theme couldn't be more relevant, and it's all about promoting the importance of mental health in workplaces. We run our psychosocial health and safety forums as biennial events, and it's great to see that it's attracted such strong attendance again today. It's clear that workplace psychological safety is a significant focus for workers and employers in our scheme, and of course beyond our scheme as well. Through these forums, we really aim to clarify the regulatory requirements for compliance, to try and provide some expert insights on psychosocial hazards, to showcase better practice approaches, and importantly, I think, to discuss case studies and particularly to learn from lived experiences. But first, some brief context on why it's so important to ensure our workplaces are psychologically safe and healthy. All Australian WHS laws require that psychosocial risks to health and safety are managed, but it's only in recent times that we've had changes to the legislative framework that spells out in some detail how these risks should be identified and controlled. The backdrop to this, or part of the backdrop to this, is also the challenging workers' compensation environment. Nationally, we're seeing increased numbers of claims for psychological injury, and these claims typically involve much more time off and much higher costs than physical injury claims. Just in the Comcare scheme for the last financial year, we saw the highest number of psych claims from Australian government workers in a decade, and they're now the most prevalent type of claim amongst APS agency. The median incapacity or lost time for these claims is more than 7 months. So it's critical that duty holders consider and review approaches to managing psychosocial risks and fostering mentally healthy workplaces. This includes effective engagement and consultation with workers and a strong focus on prevention and early intervention. Leaving it go is leaving it too late. We see these forums as a key part of our efforts to educate our stakeholders across the jurisdiction and beyond, and it's fantastic to see the continuing high level of interest in these sessions. So today we've got another packed agenda for you. First up, you'll hear from Comcare's Luca Campbell and Kelly Herron, and Safe Work Australia's Catherine Taylor for an update on the regulatory framework and other important work to tackle psychological social risks and hazards. The second session features Dr. Natalie Flatt, the Chief Mental Health Advisor at Superfriend, examining data-driven strategies to reduce psychosocial risks. And in the third session, the Australian Taxation Office's Megan Boyd and Christy Stewart will provide examples of their work to support psychosocial health and safety across the ATO. We'll then welcome Kelly Barrett from the Federal Health Department, who will look at neurodiversity in the workplace. And finally, we'll close the forum with a presentation by Curtin University's Professor Sharon Parker, who will explore addressing psychosocial hazards with work design. So I hope the forum today provides you with some of the valuable insights that you can take back to your workplaces to help encourage and enable safe and healthy work. So I'll hand over to our experts from Comcare and Safe Work Australia for the regulatory update. And again, thank you all very much for participating with us today, and I hope you get a lot out of it. Thank you.
Thanks, Greg, and good afternoon all. I'm very pleased to be here with you today presenting this regulatory update. So as Andrew said earlier, I note that approximately 40% of the attendees at the webinar today are from outside our jurisdiction. So I thought it would be good to start with a brief overview of Comcare's role as part of the broader health and safety regulatory system across Australia. Comcare is the work health and safety regulator for the Commonwealth. We administer, monitor and enforce compliance with the Commonwealth work health and safety legislation, and we also have workers' compensation and rehabilitation functions under the SRC, or the Safety, Rehabilitation and Compensation Act. Our WHS jurisdiction includes all Commonwealth Government departments, as well as some premium paying licensees under the SRC Act. We work closely with state and territory work health and safety regulators who are established under state law. We also work closely with other regulators, including the Australian Human Rights Commission, the National Heavy Vehicle Regulator, and the Office of the National Rail Safety Regulator. Safe Work Australia is not a regulator, but has a very important role to play in health and safety regulation across Australia, particularly in the development and coordination of national work health and safety policy and law reform. On that note, we are very grateful to be joined today by our colleague Catherine Taylor from Safe Work Australia. Catherine manages the Work Health and Safety Framework and Workers' Compensation Policy branch and has some updates to share with us about the model WHS laws. Thank you, Catherine.
Thank you. Can you hear me?
Yes. Yep, we can hear you. Thanks.
Great, thanks.
Catherine?
Good afternoon, everyone, and thank you, Kelly, for the introduction. For those of you not familiar with Safe Work Australia, it is a tripartite decision-making body which leads the development of national policy on work health and safety and workers' compensation. Our members represent each jurisdiction as well as workers and employers. One of Safe Work Australia's key functions is developing and maintaining the model work health and safety laws, which have been implemented in all jurisdictions except for Victoria, and this includes the Commonwealth jurisdiction. The model WHS laws aim to harmonise WHS requirements across Australia to make it easier for business working across jurisdictions to meet their WHS duties and improve health and safety outcomes. I'm going to touch on 3 new or upcoming changes, which are incident notification, sexual harassment and fatigue. These have all gone through or are going through Safe Work Australia processes. So on incident notification, the primary purpose of WHS incident notification is to alert WHS regulators to the most serious workplace incidents and potential breaches of WHS duties. The incident notification framework has focused on physical hazards and harm, particularly the type of serious incidents that primarily occur in construction and manufacturing, the industries from which the WHS laws first emerged. One of the recommendations of the 2018 review of the model WHS laws was that incident notification requirements, to amend incident notification requirements to ensure they effectively captured incidents arising from evolving work practices and industries, as well as providing regulators with the visibility needed to address work-related psychological harm. Safe Work Australia's review of the incident notification laws included significant consultation with our tripartite membership, as well as public consultation. We received 62 submissions, including one from Comcare. The review identified a range of gaps and opportunities to improve notification requirements. This included ensuring the laws appropriately capture serious injuries and illnesses, particularly in the psychosocial space. In June this year, WHS ministers across Australia agreed to a range of recommendations which aim to clarify existing notification requirements and address gaps. You can see our website for a list of the changes. The changes agreed by WHS ministers are currently with the legislative drafters, with the goal of finalising amendments to the Model WHS Act in early 2025. It's important to understand that these changes will not automatically take legal effect. They will only come into force once they have been implemented into the WHS laws of each jurisdiction, which can take some time. We know that employers will need time to adjust their work systems and processes. Safe Work Australia is developing guidance to help duty holders understand the new requirements, particularly what incidents are and are not notifiable to avoid over and under reporting. With these changes to the Model WHS laws, it is also important to reiterate that a notification to the WHS regulator is not an admission that the PCBU has breached its WHS duties. So what are the changes? A number of changes relate to issues where there was confusion or ambiguity about what needs to be notified to the regulator. For example, the need for an incident to have a causal link to work. They also clarify processes such as multiple PCBUs at a workplace needing to notify each other and the need to preserve evidence at an incident site. Other changes aim to address key gaps and provide greater certainty to PCBUs. They all relate to incidents involving a serious risk of harm. These include the fall of a person rather than just the fall of a thing, electrical hazards like arc flash explosions, and loss of control of mobile plant, such as if a vehicle rolls away or overturns. It also includes notifying serious head injuries, crush injuries, and bone fractures. WHS ministers agreed to a number of new requirements in relation to psychological health and safety, with the aim of increasing timely regulator visibility of these incidents and driving a stronger focus on preventing psychological harm. These changes recognise the seriousness of certain incidents that may not involve physical harm. This is a timely change considering the significant increase in workers' compensation claims for psychological harm and the impact of this harm on workers, families, employers, and the community. To set out some of the key changes for you, the following incidents will be notifiable. Notification of workplace violence, including sexual assault that exposes a worker or other person to a serious risk to their physical or psychological health and safety. Notification of a suicide or attempted suicide, where certain readily identifiable indications of potential work-relatedness are present. Importantly, I should note that notification will not require certainty about the cause of death or reasons for death and will not require the employer to investigate. And the notification of an absence period of 15 or more consecutive calendar days due to work-related psychological or physical harm. This aims to improve WHS regulator visibility of significant health impacts which may otherwise be missed, such as psychological illnesses, but also things like serious musculoskeletal injury. On to sexual harassment. Safe Work Australia published the first National Guide on addressing sexual harassment as a WHS issue in early 2021, as well as a range of supporting resources. While there has always been a positive duty in the model WHS laws to prevent sexual harassment, along with other psychosocial hazards, this duty hasn't been well understood. In December 2023, Safe Work Australia published a standalone new model code for practice on sexual and gender-based harassment. The model code steps employers through the legislative requirements, outlines how to apply the risk management process, and how to implement the most effective and reliable controls. The model code on sexual harassment should be read alongside the broader model code on managing psychosocial risks, as sexual and gender-based harassment often occurs with other psychosocial hazards, and PCBUs must consider the interaction between these hazards. I wanted to touch on some of the differences between the WHS and Sex Discrimination Act legislative frameworks. Having complementary duties in the Sex Discrimination Act and the model WHS laws sends a strong message that sexual and gender-based harassment will not be tolerated in Australian workplaces. While the duties in the model WHS laws and the Sex Discrimination Act are similar, there are differences in the purpose, approach, coverage, and legal thresholds. The steps that an organisation or business takes to meet the positive duty in the Sex Discrimination Act are likely to be different to the actions which will help them meet the WHS duties. In most cases, meeting the positive duty in the Sex Discrimination Act won't be enough to meet the PCBU's obligations under WHS laws. Likewise, meeting WHS duties may not equate to compliance with the positive duty in the Sex Discrimination Act, which can extend beyond conduct that presents an identifiable risk to health and safety. PCBUs need to consider both frameworks. However, from a practical point of view, I would suggest start by meeting your WHS duties, then considering if there is anything additional required by the Sex Discrimination Act. If you start with the Sex Discrimination Act first, you're likely to have to do a lot of retrofitting to meet WHS duties, such as officer due diligence duties, worker consultation, and the consideration of relevant matters like the design of work as set out in the WHS laws. Safe Work Australia has published a suite of guidance on sexual harassment in addition to the model code, and I encourage you to take a look. So on to fatigue. In 2013, Safe Work Australia published a guide for managing the risk of fatigue at work. At the time, it was unclear if the knowledge base for fatigue was sufficiently stable to use as the basis for a code of practice, whereas guidance can be more responsive to new or emerging evidence. Fast forward 10 years, and the content of the 2013 guide is still accurate and relevant. What has changed is the acceptance and community expectations on the scope of what should be addressed. Last year, Safe Work Australia members agreed to develop a model code of practice on fatigue, and we're well advanced in the drafting. We expect to release it for public comment in the next few weeks. In drafting the model code, we have more comprehensively addressed a couple of areas only lightly touched on in the guide. These are health risks associated with fatigue, not just the risk of fatigue-related accidents or incidents, and the impact of tasks, equipment, environment in causing fatigue, not just the hours someone is at work. If you have an interest in the development of the new model code on fatigue, you can subscribe on our website and be notified when the public comment period commences. So that's it for me. I'd like to thank Comcare for inviting me to present today, and I'll hand back over to you, Kelly.
Thank you again, Catherine, for joining us today and to provide that very informative update. So just a couple of important messages from Catherine's update from a Comcare perspective. It's important to note that any changes to incident notification provisions will not take effect in the Comcare jurisdiction until the Commonwealth Work Health and Safety Act is amended by the Australian Parliament. And that would be likewise in other jurisdictions across Australia, just noting that there was a question in the chat on that. So each jurisdiction is responsible for updating their own act. We acknowledge that for some of our jurisdiction, changes to the notification provisions will require updates to your systems, policies and procedures. Comcare will continue to liaise with the Department of Employment Workplace Relations, who have responsibility for the Commonwealth Health and Safety legislation, and will keep you updated as these important legislative changes progress. With that, I'll now hand over to Luca to provide you an update on Comcare's regulatory activity when it comes to psychosocial hazards and risks. Thanks, Luca.
Thanks very much, Kelly, and thank you, Catherine. Good afternoon, all, and welcome to today's Psychosocial Forum. So as part of our corporate strategic planning process, we've identified some priorities that will guide our work between now and 2028. You'll notice the first strategic priority on the screen there is to prevent work-related injuries. So we've committed to focusing our efforts on the prevention of injuries and psychological injuries in particular, in order to drive positive changes and make workplaces safer. We've also identified psychosocial hazards as one of our 6 regulatory priorities. And if you would like to learn more about our regulatory priorities, you're welcome to view our webinar on this topic, which was published in July of this year, and it's available on our website. And I think there's a link that's just been shared in the chat window for you for your interest. So for Comcare to regulate effectively, it's important for us to have information about contemporary issues in our jurisdiction. One of the important sources of information we rely on is, of course, notified incidents, which are reported under Section 38 of the Work Health and Safety Act. On the screen here, you can see the number of notified incidents we received over the last 3 years, and we've broken it down for you into notified incidents relating to psychosocial hazards or psychological injury, which are in the orange colour there, and all other notified incidents, which are shown in blue. So up until 2023 to 2024, the number of notified incidents relating to psychosocial hazards remained stable. We saw a significant increase in 2023, and we think that that's possibly due to greater understanding and awareness of PCBUs into psychosocial matters in the workplace. We also think it might be due to some targeted engagement we've had with specific PCBUs in our jurisdiction. Now, the circumstances that we receive notifications regarding psychosocial hazards and psychological injuries at the moment are quite narrow. And as Kelly and Catherine mentioned earlier, there'll be some changes on the notification requirements over the medium-term horizon. So we think these changes will strengthen our ability to regulate effectively using data and intelligence and to make well-informed regulatory decisions. In addition to notified incidents, you may be aware that Comcare also receives work health and safety concerns from workers and others through our Work Health and Safety Help Desk. The number of work health and safety concerns we've received relating to psychosocial matters has actually remained steady over the past 3 years. And of the 223 work health and safety concerns that we received over this period, it was interesting to note that bullying was the most prominent topic identified, and it accounted for about half of all concerns. Now, that doesn't mean that bullying is the most prominent issue in our workplaces. It just means they're the ones, bullying matters are the most prominent that are coming to us, which may mean that other psychosocial hazards are being resolved in other ways, including through local issue resolution procedures. One of the actions we often take when we receive an incident or work health and safety concern is that we assign the matter to an inspector to conduct what we call monitoring compliance activities. And that might be, for example, a workplace inspection. So here we're looking at the number of monitoring compliance activities we undertook in the last 3 years relating to a psychosocial matter. You'll notice a sharp increase in 2023 to 2024. The majority of this increase was in response to notified incidents relating to psychosocial hazards or psychological injuries. Again, that relates, I think, to that targeted engagement that I was talking about on the screen 2 slides ago. Okay, so the data I just presented illustrates the need for us to continue our focus on prevention, particularly when it comes to preventing psychological harm and harm from psychosocial hazards at work in particular. We've set out to be a leader in the prevention of psychological injuries and to increase our influence, appropriately sharing insights to effectively drive positive change with employers and employees. Our focus areas when it comes to prevention are to optimise regulatory and safe work approaches, to enable employers to prevent work-related psychological injuries, and to improve prevention through insights, innovation, and influence. So I wanted to just spend a moment now just unpacking the term psychosocial hazards. I know for a lot of us in the room, it will be a very familiar term, but it is something that's fairly recently entered our language as work health and safety practitioners, as others in the workplace with an interest in work health and safety. So it's always important to just come back to the term and what it means. So when regulators like us use the term psychosocial hazards, we're talking about hazards that are relating to or arising from the design of work, the work environment, plant in the workplace, or workplace interactions and behaviours, and that may cause psychological harm. We also know that psychosocial hazards can cause physical harm as well. And we know that there are at least 14 psychosocial hazards, and these are set out in the Model Code of Practice. They're displayed on the screen now, and they can be grouped into two broad categories. The first is hazards relating to the design or management of work, and the second is hazards that arise from harmful behaviours, such as bullying, which I talked about briefly before. It's also important to remember that hazards may interact or combine to create new, changed, or higher risks. And some of these hazards might not create psychosocial risks on their own, but they might do so when combined with other hazards. So this complex, non-linear, and often compounding effects of psychosocial risks can be a challenge, but it's certainly a worthwhile challenge when we think about the significant economic and social impacts of work-related psychological injuries. And I'll touch on that briefly now. So what we know about psychosocial risks in the workplace is that when they're not managed, they can have a series of negative consequences. So we know they can contribute to, of course, psychological injuries. So for example, anxiety, depression, PTSD. We also know that psychosocial hazards can contribute to physical injuries, which I mentioned earlier. So musculoskeletal disorders is a good example where the impact of stress and strain on the body can also be influenced by psychosocial factors at work. We also know that psychosocial hazards can contribute to non-communicable diseases, including cardiovascular disease, poor morale, reduced productivity, such as presenteeism, fatigue, or conflict, unscheduled absences, and also integrity risks, particularly when psychological safety is lacking and workers are afraid to speak up out of fear of reprisal. And as I mentioned before, significant impact to individuals, workplaces, and to society. But on the flip side, it's important to remember that good psychosocial risk management actually has a whole lot of benefits to workplaces, and creating mentally healthy workplaces should be something we're all aiming for. The benefits extend far beyond health and safety, and it can include reduced absenteeism and reduced lost working days, increased productivity, greater job satisfaction, and reduced staff turnover. We also know that a mentally healthy workplace can help in attracting great talent into the workplace, which is also an excellent positive. And we know from economic analyses that for every dollar spent on evidence-based mental health actions, an organisation receives a return on investment of about $2.30. But the more important benefits are perhaps unquantifiable, because we know mental health is a critical aspect of our overall well-being, and that work plays a really significant role in our everyday lives. So I'll talk now about the way that we regulate psychosocial hazards within Comcare. So we have a dedicated psychosocial regulation team within Regulatory Operations Group. The team was established in 2022, and most of the time since then, it's been staffed by a team of 4 inspectors. And we're currently going through a period of a growth spurt. So we've had an additional 5 inspectors that have recently come on board. And so the total number of inspectors is now 9, which is fantastic. Although we have a specialist team, our philosophy has been that in the contemporary environment, all health and safety inspectors need to regulate psychosocial risks. And we take a multidisciplinary collaborative approach within the inspectorate, which enables us to deliver targeted, proactive regulatory programs. One of the key deliverables of the psychosocial regulation team has been the proactive psychosocial inspection program. The program was piloted in 2023 through to the beginning of this year. And we recently engaged the University of Queensland to conduct an independent evaluation of the program. The evaluation looked at the program processes and resources and involved interviews and surveys with participants at all 3 tiers of participation. So that includes executive leaders, workers and health and safety representatives and health and safety teams, and individual meetings with workers in particular groups of the organisation. The evaluation found that the program met its objectives and was perceived positively by both PCBUs and the inspectors that took part in the program. Of particular note, a few highlights here. 92% of participants agreed that their knowledge of the range of psychosocial hazards improved as a result of the program. 85% of participants reported an increase in commitment to psychosocial health and safety, and 70% agreed that the program assisted their organisation to comply with legal requirements when it comes to psychosocial risk management. We also received 18 recommendations for improvement, predominantly in the tools and resources, PCBU communication methods and data collection processes that the inspectorate were using. We've accepted those recommendations and will be guided by the findings of the evaluation as we plan to transition the program to full-scale implementation early 2025. And we're also in the process of creating a specific website for our proactive program, which will include additional resources, guidance and information about our approach. We expect to release that in the near future. So thanks very much for listening. I hope you've found that interesting. I'll hand back now to Andrew, who's going to talk us through some Q&As.
Yep. Great. Thanks, Luca. And time, of course, is pressing on us. So we might just do one question that has come through. We've had quite a few that came in around tools, approach and frequency for assessing psychosocial hazards and risk. So I might just start with, can Comcare tell PCBUs or organisations how and how often they should assess psychosocial hazards and risk?
Yeah, sure, Andrew. I can perhaps answer that one. So I guess the response is that there's no hard and fast rule. There are some specific requirements that I'd point to in the work health and safety regulations that might trigger a PCBU to review and revise risk controls. They include things like when a health and safety representative for a work group has requested a review of risk controls. I'd encourage anybody who's interested in that particular question to refer to part 3.1 of the regulation. But in terms of how PCBUs should assess risks relating to psychosocial hazards, we have a great suite of guidance on our website. And you can also refer to the Code of Practice, which points to the specific processes that should be followed and actually includes an example risk register in the appendix to the Code of Practice, which is extremely useful when you're trying to document and find out which hazards are a priority to deal right now and which ones, deal with right now and which ones, are less of a priority, but perhaps still very important to tackle.
Thanks. And I know there's been quite a few questions in the Q&A that have been responded to, so I might just pick up on just one more before we move on, which is, are there any tools or resources to help PCBUs to help identify and quantify psychosocial hazards and risk in the workplaces that you could point us to?
Sure. I think I'd love to give a bit of a shout out to the Wonderful People at Work tool. People at Work is a free tool which the heads of workplace safety authorities, so all of the CEOs and equivalent of regulators like Comcare have agreed to this particular tool. It's called People at Work, and it actually goes through a systematic approach to surveying workers and getting insight into which particular psychosocial hazards might be an issue in a workplace, and it has a great set of resources behind it as well in terms of the next steps after you've received that report. What do we do now? So that's the number one resource that I would recommend.
Thanks, Luca. And I might also plug our these webinars and forums. Of course, that's another key way that people get access and information about the tools and resources. Of course, Comcare's website as well. So to keep our agenda on track, we might keep rolling and save some more questions for the end, but also might mention sound. There was quite a few mentions of people having sound issues in the chat. The webinar is being recorded and we'll be producing a transcript which will come with the closed captions for the recording as well. We did note that quite a few people, when they left the forum and came back in, that improved their sound quality and their ability to be able to see the notes as well, see the slides. So sometimes a change of view can help you to update your slide settings. All right. So I might also mention that in a forum like this, obviously we can only respond broadly to questions and answer kind of generally. So if you do have a specific question or concern about a particular issue relating to Comcare's either regulatory approach or your specific organisation, please reach out. Please reach out and contact Comcare's Work Health Safety Help Desk at in the chat there, and your questions will be considered and responded to appropriately. So the next session that we've got is Dr. Natalie Flatt, who's Chief Mental Health Advisor with Superfriend. Superfriend's a not-for-profit organisation that's backed by superannuation and the insurance industry, and it's dedicated to transforming mental health research into practical, powerful solutions that benefit workplaces and employees. And Dr. Flatt will be sharing with us some of the latest 2024 insights from the Indicators of a Thriving Workplace, which has drawn data from over 4,000 workers. And among other things, we'll explore the strong connection between psychosocial health and safety and effective utilisation of mental health resources in the workplace. Dr. Flatt's a registered psychologist who began her career as a researcher, studying new therapies from overseas and analysing their effectiveness in the Australian population. With over 15 years' experience working across a range of industries and lifespans, Natalie values the how-to approach to wellbeing, supported by research evidence that leads to greater motivation and behaviour change. Natalie is a Victorian Committee member for the Suicide Prevention Australia and a member of the 2024 judging panel for the 2024 National Safety Awards of Excellence. And Dr. Flatt will be discussing a range of practical strategies for leaders to enhance the use of tools and resources, breaking down barriers such as stigma, accessibility, relevance, and lack of awareness. So over to you, Natalie.
Thanks so much, Andrew. That was a bit of a mouthful, I think, at the end, wasn't it? So you did well there. And look, thanks everyone for attending today, especially on this important day. And we really want to be, looking at what our data can show us and really focusing on that how-to is using that interrogative voice. We've got the awareness and how we can then bridge that into action. And that's what we really, part of that major focus of us at Superfriend is just that. So Andrew,
Natalie,
I know that
I might just get you to check your camera setting, just to pop that on.
It is on.
Okay, well, it could be a Teams issue. We have been having a couple of little technical jumps and starts.
I've turned my camera off and then I'll turn it on again. Is that
got
better?
Other people who can see you, so it might be an individual issue.
It could be you. Okay, that's great. Thank you. Okay, so just we want to be looking at those data-driven strategies, as Andrew mentioned, to reduce psychosocial risks, but also improve clinical outcomes. And this is something that Superfriend has moved into with the data. So let's start off with who we are and really what we do. So one major part of Superfriend's work is looking at our flagship survey, which has been running for, it's in its 10th year now, really moving into its 11th year, and it's called the Indicators of a Thriving Workplace. And the aim of this flagship survey is really to provide the national and industry benchmarks for factors that influence workplace mental health. So on this slide, you can see that we ask a variety of questions that are going to relate to these factors. And to communicate these aspects effectively, we used 5 domains of a thriving workplace, which are displayed here. And you can see on the right that we've grouped multiple questions under each of these domains, and they fall across leadership. And so our leadership domain really explores how leaders support their teams and manage their own mental health. And we move then into connectedness, where the focus is on the quality of the interpersonal relationships within a workplace. And this is then followed again by the safety domain, which addresses the policies and practices related to harassment, to bullying, and to discrimination at work, to name a few. We then look at work design, and many people still think work design is in terms of just remote work only, but it encompasses much more, includes how employees have a voice in important decisions about their roles and how they carry out their work, not just where they do it. And then finally, capability. So this domain really reflects a real world ability of the workplace to support mental health. So it's not just about having policies in place, it's about whether employees can access support in a confidential manner. And so what we do is we score each of these domains out of 100, with 100 being the ultimate, the ideal score. So a higher score indicates a better outcome for workplace mental health. By surveying tens of thousands of Australian workers, we can establish a national and industry benchmark score for each domain. And this really helps us identify priority areas for action. So if a domain score is significantly below the national industry average, that's where we can direct our focus and improve efforts from a workplace wellbeing level. We've now been running this, as I said, for 10 years. We've surveyed over 76,000 individuals across Australia, and one of our latest decade of data report is available on our website for download. So looking into our results, so currently we are capturing wave 1 and wave 2 data, moving into wave 3 data by looking at things a little bit differently via seasons for this round of data capturing. And so these are hot off the press wave 1 and wave 2 data. And what we notice here is that the domain scores are just like previous years, and we see that connectedness is actually still the highest scoring domain. And so what this means is that in general, people feel quite connected, and they have a good quality of interpersonal relationships is still high. We see that safety is the next best scoring. So, which for me, that kind of makes sense, because safety is about eliminating the obvious things at work that causes problems, such as, we've been getting better at addressing bullying, harassment, and making sure that, we do have those policies and procedures in place for workplaces. Like previous years, we've found that leadership does sit in the middle, and we know that leaders, they have quite a large impact on areas like workplace culture and how people are feeling in the workplace, and really influence the comfort people have, or the psychological safety people experience within the workplace. But the lowest 2 domains, again, which we've consistently seen, is around work design. So it's about how roles and about how our work is done, and also how it's organised. So we know that lots of industries have particular challenges around, such as workplace flexibility, for example, healthcare. And it's not possible to work from home for many of our healthcare industries and workplace forces. And this is where we can capture this data. But I suppose around the red box there is capability, and this is where I probably really like to hone in on, is because we've seen this continually be one of our lowest scoring domains, and this is where the most improvement can still lie, and it comes down to the real world ability for workplaces to support their people's mental health. And it's not just about having an EAP, it's making sure that people know that there's an EAP, and additional resources that they can access, how to access that, the impact of that, of them accessing that, and ensuring that it's confidential and there are no consequences if any form of training and resources are actually accessed. And so you can see at the bottom of this slide, which I'll address again, that our recent data has pulled that only 6% of this wave of data states that they've access to healthcare professional through the workplace, and 14% are still seeking to go outside of the work there. So looking into our next slide, as I said, we capture the 5 domains, but we also then capture the psychosocial hazards. And Luke has just he's highlighted that, you know, the Comcare and Safe Work focus on 14 psychosocial hazards. You can see that we capture 9, but our 9 key hazards across our 5 domains really still encompasses the 14 psychosocial areas. It's just the way our data falls and how that maps closely to our framework also. But these domains still allow us to comprehensively assess psychosocial risks in the workplace. Now, each hazard is evaluated through multiple questions, and the scores provide that clear view of how well these risks are being managed. So a higher score means better management, and a lower score means it signals area of concern. So we'll start with probably with the lowest, and we still see that low recognition continues to score pretty poorly. So very similar to what we found last year. And this is really indicating that many employees or respondents to our survey still feel undervalued and under-recognised in their role. And this can directly impact their mental health and overall well-being. Another area that's consistently scoring low is that change management. And that's just indicating that employees can often feel unsupported or uninformed during some organisational restructures and changes, and also how that then connects in with that leadership domain too. But on the other end, we can look at relationships and fairness, and this continues to score the highest within our survey. And this is really encouraging, especially when we think about the importance of our connectedness domain. And then we look at our environment, and this is, employees are stating that, the way that their environment is constructed, that they are feeling quite connected, or that there's connected accessibility and differences in connectedness within workplaces, and that has created that level of support and camaraderie within their workplace. So one of the strengths that, one of our data is the ability to rank the psychosocial hazards by industry. So this is what our report also really delves into. I won't go on this today, but our newest report will be coming out earlier in 2025. So please keep an eye out on that. And we'll actually look at the 19 industries we track and identify which hazards require more attention, which then again allows us to tailor our approach to different sectors and targeted interventions where they're most needed. Next slide, Andrew. So, as I said before, we also incorporate clinical outcome measures. We understand that this is a very important movement, from the workplace wellbeing silo, is how people are actually feeling from a psychological impact and measure. And we use the Kessler-6 within our survey. So this is actually measuring the levels of psychological distress. Now, according to the latest data, we've collected 55% of our respondents reported experiencing moderate or severe psychological distress in the past 4 weeks. So this means really that more than half of the workplace surveyed are showing moderate to severe anxiety or depression, or at risk of moderate to severe mental health diagnosis here. So this is a real significant figure for us, and really highlights that pressing need for the mental health support in the workplace. And if you just, take yourself back a couple of minutes to what I discussed about the capability score, is that we've got 6% of our respondents actually accessing mental health support within the workplace, but we're seeing such a high or a significant amount of distress also within the workplace. So this gap here, this is where we want to explore, investigate and intervene, because we also believe that this is a gap where claims are also caused and created there. Next slide. Brilliant. So we learn a lot about burnout, and and this is not an uncommon definition or occurrence that is now being measured within our workplaces. And we've used the burnout assessment tool for this rounds of surveys, the shortened version, the BAT-12. And just to really, provide a brief definition here, the burnout is characterized as a state of mental exhaustion, and it manifests as both an inability and an unwillingness to engage in work. So there's two aspects that are closely linked here, which is that we talked about the inability, which refers to the exhaustion or the chronic fatigue that can hinder our ability to carry out our work effectively. And we can have those thoughts or those narratives, I can no longer do my work. Or then we've got the depersonalization or the unwillingness, the mental distance, dare I say, from work, which can result in feelings and thoughts of, I don't want to do this job anymore. But as that chronic stress, that leads into burnout and it's continually persisting, this is where we can see, employers and leaders, workers struggling to regulate emotional and cognitive processes, and it can cause a significant decline in interest and motivation. It can lead to feelings of helplessness and being trapped and defeated, and accompanied by a lot of, loss of enthusiasm and increased cynicism. And this is where we can see, that it flows out into personal life and personal well-being as well. So what we actually see in this slide and what we've captured within the BAT so far is that we see that 45% of the total workforce is stating that they have a risk of burnout or feeling as a definition of burnout. It's not unusual when we, again, within our report it will come out, but the younger cohort is displaying a higher level of burnout at the moment, the Gen Zs and Gen Ys. And it is, we've also then seen that there is a high or a strong correlation of around 0.65 between burnout and distress. So that probably wouldn't, surprise anyone, but this is significant data that we really need to highlight and hone in on what we can do. So, to take this snapshot as it is, this is burnout by industry, and this is what we do at Superfriend, is we're able to split it down, our findings across the 19 industries, and encourage you just right now just to maybe even zone your eyes into where you lie, and in what area and what industry, or what industry might even be of interest to you right now, and just have a bit of reflection. Do these resonate? Do these statistics here resonate with your experience within the workplace? And maybe even are there signs that your employees might be at risk of developing any of these burnout symptoms, now that I've provided that definition. These are the common factors that contribute to to psychosocial risks, and we're looking then at heavy workloads. We're looking at that lack of support. We're looking at high pressure environments. Are these also present within your teams? And we know that we also need to consider that every industry has its own set of unique challenges, but again, a great way to reflect, there are any specific risks in your industry that might make burnout or mental health or psychological distress more likely. So this is where we try and create data that creates that conversation as well, and that then allows us to come and tailor bespoke intervention. Again, I'll speak about that shortly. So, overall, that was a very quick snapshot of what we've found hot off the press. And as I said, that the large report waiting for wave 3 and 4, and then aggregating all that data for our report and presentation early in 2025, is really highlighting the critical importance of, not only our 5 domains, and especially that low score around capability, but then also being able to place that next to our clinical outcomes that we're finding, and then placing those psychosocial risks and, how that can actually create and be that variable or that driver in in certain instances over certain industries. And what we want to prioritize is that when we prioritize mental health, and safety, we can not only enhance the well-being of our employees, but we boost overall productivity. And that's something that we really pride ourselves on at SuperFriend, is that our data can be taken as a strengths-based approach. And what we want to be doing is we want to have a positive impact on mental health and safety. And as our CEO continually says, that work should be good for people. And we still believe that everyone who goes to work, they believe that their workplace is safe, and they believe that this forms part of their identity in a positive way. And so what we want to just make sure, moving forward, and especially on a day like today, it's essential to recognise and address that psychosocial risks correlate with better mental health outcomes, and a safe and supportive work environment, it does establish employee wellbeing and minimise stress-related illnesses. So it's not just about compliance, it's about creating a culture where our staff and our teams can thrive. And having those early intervention strategies and even bespoke strategies is really important to identify within your workplace. And that effective approach to managing those psychosocial risks it becomes more effective when we can prevent them from escalating through tailoring our intervention strategies to the unique needs of our teams, and assuring that we address those specific challenges that they may face by implementing right targeted training sessions, or offering those personalised mental health resources to support those. And again, making sure that those mental health resources are accessible. That's a real crucial component. It's EAP should not be looked upon as a tick of the box or as a reactive approach anymore. Wellbeing initiatives, they play a vital role in lowering this the psychological distress. And data shows that when employees have access to these resources, we see a significant improvement in overall workplace wellbeing. We also want to be able to create that protective layer, and building that psychological safety is also key. When employees can feel psychologically safe, they're more likely to voice their concerns and seek help without fear of judgment or even those negative consequences. And this encouragement, building that culture of support and in a non-judgmental way, it's really invaluable in mitigating a lot of risks and enhancing those mental health outcomes. So what can we do? What are some practical strategies that leaders can implement to enhance the utilisation of mental health resources within their organisation? And it's really crucial that we don't not only have these resources available, but it ensures that our employees are aware of them and feel comfortable using them. And addressing that stigma, we want to be able to build that psychological safety, being able to address stigma in the workplace. We've come a long way, but there's more work to do. And no matter what hat you wear, we all hold those similar emotions, don't we? And it's tied in with the individual, in our own individual experience and our own life events. And so being able to create that, that we are all human mentality within any workplace is a great step a great place to start, or a great perception or expectation as leaders that we can hold. Because one of the biggest barriers that we can see in seeking mental health support within the workplace is that fear of being judged. Now, as leaders, we can promote open discussions, even just about mental health, and really start to normalise conversation and how the workflow of being able to seek confidential support. And by creating this culture, it's going to encourage employees to feel safe in expressing their struggles and reaching out for help much earlier. And we can start to see, well, what we're hoping to see at SuperFriend is that the psychological distress percentage start to go down. People are actually accessing services within the workplace before or when their distress is not as high. Leaders can, they can lead by example, by modelling self-care, being able to build that environment where employees feel safe to discuss their struggles. Sorry, Andrew, I think you might have gone a bit fast there on that last slide. Thank you. Also we're just ensuring that accessibility, how are our mental health resources easy and accessible, maybe even through multiple channels, like are the channels that you're accessing it, is it getting the right visual based on the way your workforce is also, designed? If it's an employee portal, mobile apps, in person, ask your teams, how would you actually like to see this information being shown? The goal is to remove any barriers that might prevent employees from accessing the support they need. And again, really highlighting this is a confidential, but the easier that we make them, the more likely they are to seek help. And really tailoring it for relevance. We know that it's not a one size fits all approach. What are your team's unique needs? What do you see within the workforce that might be able to assist them? And what we're aiming to do is to really avoid that well-being washing, where programs might look really nice and shiny and great on paper, but they don't actually have any level of impact and address the needs of your teams. So having that feedback loop, having that assessments, it can really help you understand, what your teams truly need, and then, having that ability to adjust programs accordingly. And it also saves energy, time, and money. And lastly, we really want to be able to promote that awareness and then encourage that action. Conducting regular, training sessions and communication campaigns with your EAP, being able to build that relationship and showing that your EAP has a face can be also really important to break down that barrier. And EAPs can offer more than just that one-on-one support, and being able to understand who your EAP are is going to provide you with being able to be that advocate for that support within your workplace there. Sorry, next slide now, Andrew. Thank you. Well, we all have a crucial role in creating that inclusive and sustainable, environment where mental health is prioritised. And when we prioritise the well-being, we enhance that overall workplace culture. And we can also then make that a fundamental part of an employee value proposition and part of our business strategy. Well-being needs to be part of who we are as a workplace culture, and what is our mission and vision. Well-being in that is going to start to attract really great talent. It's going to lead to more significant benefits, where we're looking at a reduced level of staff turnover, a reduced level of absenteeism, a higher level of connectedness. We know that employees are more likely to stay within an organisation that values mental health. And that's going to be obviously a cost saving, from a claims perspective, but also from a turnover perspective and recruitment and training. Prioritising the lower rates of claims related to mental health issues that's where we really want to be able to get to, and proactively addressing mental health, reducing those risks with workplace stress and creating those healthier and more productive workplaces is so part of our culture that needs to be addressed and nurtured. And overall, the sustainability, well-being is a discipline. And we look at that from an individual level, but even from a workplace level, it's not a set and forget. We continually being able to have this visual, being able to talk about this, and having those actions that we create, sustainable, easy, relatable, realistic, is just really important. Making sure that we're able to, update them and again encouraging and continually, within our working week, why well-being is going to create that level of fitness that's, going to be helping us from a physical perspective, but also from a productivity perspective and innovation and a creativity perspective too. Fabulous. Well, look, that's the end of my presentation. Thank you so much for listening. But look, at Superfriend, we really understand the challenges that that leaders can face in promoting the mental health and wellbeing, and we offer a lot of free access to valuable resources and tools. And our standout offering right now is a Thriving Workplace Index, which is a comprehensive tool that measures our organisation's health across the 5 domains. And this allows you then teams to benchmark your workplace against the industry standards and the national average, and also assessing those results, we can provide tailored advisory services to really pinpoint those specific opportunities for improvement. We've got many more. Hopefully you can access our resources and sign up to our newsletter, and look out for the next indicators report coming in early 25. And I do apologise, I think I've gone over time, Andrew. Sorry.
May have a little bit, but I tell you what, if you've been looking at all the comments, there's a lot of really positive feedback. Thank you for your presentation. Really engaging
Pleasure.
and very valuable.
Thank you.
Some really interesting conversation in the chat there, asking sort of some technical questions about the measures that are used and the timeframes. Also some really interesting, quite a lot of conversation around the generations as well. So maybe I might hone in on one, which is that highest burnout is in Gen YZ. Why is that? Have you got any insights you'd like to share around that?
I'll take some implications there. I'm not, my beautiful research team, which I think are on the call, Mel Jeffries and Di Shepherd. Thanks for dialing in. So I'm not part of the real technical piece there, but we're looking at they've got a high level of mental health literacy. Many of the Gen Zs and Gen Ys, they did get affected. More so Gen Zs by that COVID time, where we're looking at their level of mental fitness. We know that there is a generational difference, across our essentially our 4 main our areas of generations. But, we're looking at that there is because of their mental health literacy and because of their understanding, we're seeing that there's a different level of the way they perceive work compared to the older generations there. And so that expectation can be a little bit different. And so they feel a little bit more, and they're but I think that again is that because they've been brought up around that, more so that social and emotional upbringing in school times, that they're a little bit more connected and around mental health. So, it's how we can actually build both ends up by identifying and addressing one end, so we're not getting to that highest level of distress, and being able for the Gen Z, the Gen Zs and the Gen Y, who have had a lot more information thrown at them at an earlier age, to be able to differentiate that and create that balance of stress management too.
Yeah, great. And there were quite a few questions, particularly in the lead up, around developing line manager capability related to psychosocial hazards and mental health. And great to see that link to the resources. There's some really valuable places for people to start in that space as well. So I might hold further questions as we are pressed a little by time. And if you've got space and we've got time, we might throw a few more towards the end. So in our next session, we've got Megan Boyd and Christy Stewart from the ATO. And by way of introduction, Megan has worked in the ATO for 22 years and appointed as the role of Assistant Commissioner in the ATO People in 2017. And Megan leads the Working Well branch, which includes health conduct, work health and safety, personnel, security and performance teams. But before working for the ATO, Megan already had a breadth of experience, having worked in over a dozen small, medium and large public sector agencies. Now, Christy has got over 17 years of HR experience across the APS, having led a range of teams, including early intervention, workers' compensation, work health and safety portfolios. And Christy's currently the Director of Health for ATO, managing both early intervention and claims liability management functions. The ATO operate under a delegated claims management arrangement for workers' compensation and continue to demonstrate sustained performance. And during this presentation, Megan and Christy is going to share some of their examples of work that's being done to support psychosocial health and safety in the ATO and highlight some of the insights and the lessons learnt and practical considerations for others who might be considering a similar approach in their workplace. So welcome, Megan and Christy. Thanks for being here.
Thanks very much. Lovely to be here today at this forum to present to you some of the work that we undertake in the ATO in this area. And I'd just like to say up front that we are more than happy to share any of our information, our tools, or just talk to you about any topic you like. We're more than happy to share across the community. So what I'm going to talk to you about today is a little bit about the ATO background. And then I'll talk about our psychosocial risk assessment here in the ATO. I'll touch on our SES masterclasses, which is one of the tools that we use. Talk a little bit about our capability uplift, and then I'm going to hand over to my colleague Christy Stewart to talk about some of the early intervention strategies we have here at the ATO. So just by a way of background, we've been fortunate at the ATO in that our psychosocial journey actually started quite a few years ago. We had our first mental health strategy that we launched in 2018, and that strategy was our commitment to build mental health awareness and also maintain a mentally healthy and supportive workplace. We have a dedicated mental health team called Thriving Minds, and I know we work with a number of APS agencies on what we're doing and sharing some of the things that have been developed there. And from that, we developed and implemented a mental health risk framework, which largely focused on prevention activities and also included how to identify and manage the factors at work which impact on staff mental health. These factors we now know as psychosocial hazards. This framework guided our efforts across early intervention and rehabilitation as well, which, as I mentioned, Christy will speak about shortly. So when Safe Work Australia published the model Managing Psychosocial Hazards in the Workplace Code of Practice, we pivoted our work, which is a word that everyone uses, but we pivoted our approach and refreshed our mental health risk framework to become our psychosocial risk framework. We did a gaps analysis to inform our implementation plan and make sure our framework was closely aligned to the Code of Practice. And we also conducted the ATO's first psychosocial risk assessment. So just moving on to our psychosocial risk assessment, what we did to set that up is we used data from the previous 18 months to provide a snapshot to us of our current ATO psychosocial risks using the hazard categories from our risk framework. The risk assessment also has a list of our corporately available risk controls and recommended actions to mitigate psychosocial hazards. This risk assessment tool is a quick reference that can be used by anybody in the ATO. It can be used by teams or business areas to develop their own psychosocial action plans. Our intention here was to simplify the psychosocial risk management and reduce duplication of risk assessments, particularly where we've got a lot of work types that are quite similar. So when business areas go through the process of developing and customising their own psychosocial action plan, they also create the opportunity to consult with staff in relation to these risks and seek ideas from their teams and staff on practical solutions. So the ATO psychosocial risk assessment was finalised last year, and this year our efforts have been on operationalising the risk assessment by supporting the different business areas on developing and implementing their psychosocial action plans. So moving on to our SES masterclass, another part of our psychosocial implementation was our SES masterclasses, and these are 1 hour webinars which we recorded, but we also had a half hour of informal Q&A at the end of it, and we didn't record those and the reason for that was we really wanted to have open and honest, I guess, discussions with our SES colleagues. We do these SES masterclass because we recognise our senior leaders have the most significant influence on managing psychosocial hazards in the workplace, and that's through their decision making and the impact of that, prioritising worker health, safety and wellbeing. These masterclasses gave an overview of the legislative changes and then we put it into the ATO context and what it means for them as officers under the WHS Act. We informed them of what has been set up at the enterprise-wide level, which has been our psychosocial risk framework, risk assessment, and really their obligations to utilise these tools to protect worker. Somebody I can see is coming up in the chat about slides. We actually don't have slides, that's why it's not moving, so apologies for that. The masterclass also covered the importance of senior leaders championing behaviours to set a positive climate and build psychological safety. I think we've got somebody who's not on mute, or is that me echoing? I'm not sure. So we want our senior leaders, as I said, championing the behaviours to set a positive climate and build psychological safety, because we want to make sure that we're managing these risks. So there's three things we focused on in these masterclasses. The first one is the obvious one around communication. We want our staff to know that mental health is a priority, and we want the leaders to do that by demonstrating concern and compassion for all of our staff and show value and appreciation, and encourage staff to share their thoughts. The second part of it was check-ins. We wanted to make sure that they were regularly checking in with workers to proactively identify psychosocial risks and understand what is and isn't working. Interestingly enough, with the check-ins, and I'm sure other agencies are the same, during the COVID years, I think most agencies got really good at check-ins. We were all working remotely, and that seemed to work really well. But certainly here at the ATO, we found that dropped off a bit once people started returning to the office. So that's been a bit of a focus for us. The third focus we had here is about taking action. So once you've identified the risk, what do we do to manage that? And one of the ways we encourage our SES to do that is develop a psychosocial action plan. I should probably mention here, because I keep talking about the psychosocial action plan, we haven't mandated that. But what we have found is that most business areas are taking up this option. And that isn't to say that business weren't already proactively managing psychosocial risks. Some teams had already long established things in place to have risk controls implemented. But this is a way that it helps business pull that together to make sure that all the relevant risk controls are there, and in a format that makes it easier to demonstrate compliance as well. And that will help us get ready for the proactive inspections. As part of our masterclasses, all the participants were also sent an SES toolkit to support their learning, and that included a template for the psychosocial action plans. We wanted to make this as easy as possible for people to take up this option. Part of the masterclass as well, we broke people into small groups. We actually got them starting to fill out their psychosocial action plan, and we had a focus in those classes on role overload and emotional demands. This practical exercise, I think, had a pretty good uptake, and it was a good experience. People have that hands-on opportunity. I'll now talk a little bit about our capability uplift. So as part of our psychosocial implementation, we also focused on psychosocial capability more broadly across the ATO. And we did that by updating our mandatory training packages for workers, managers and officers. I'm sure you've all got those. So that all people understood what the psychosocial hazards were and what their responsibilities are in relation to that. On our intranet, we developed a psychosocial risk control toolkit, as well as a manager's toolkit and self-serve resources. We promoted these resources in our communications to officers and managers. We also promote this through our HR business partners and HR generalists, as well as our health and safety representative network. We also developed some targeted interactive webinars and self-paced e-learns. So we also delivered masterclasses to our EL2 cohort about managing workloads. So that helped those directors develop practical strategies that they can apply at the individual and team level. Another example is we have an e-learning product called Emotionally Demanding Work, and that helps train our staff to deal with difficult client interactions by giving them a framework, as well as some practical options for responding to these issues and self-care strategies. We also, as part of this series, developed a manager module to help managers recognise people showing signs of possible distress and steps on how to debrief with staff and where managers can go to for assistance. So I might hand over to Christy at this point in time, who's also going to be sharing some of our prevention and early intervention strategies, which we've had in place for some time. Thanks, Christy.
Thanks, Megan. With an increase in awareness of our psychosocial risks, we've seen an increase in the number of incidents being reported that impact on staff wellbeing, from individuals raising concerns regarding workplace demands and task variation, to the identification of risk in dealing with difficult employees. Psychosocial concerns are front of mind for many. One of the most commonly reported incidents we're seeing looks at the impact of staff behaviours on the wider environment. Where staff are behaving badly, managers are reporting concerns for their own mental health and the mental health of others within their span of control. Today, I'll talk to some of the early intervention strategies that the ATO have implemented to best address the issues that we've been experiencing across business. These include the business line action plans, which Megan's touched on, implementation of a Thrive at Work program, provision of our EOP service, establishing an early treatment program and an early medical management advice program, and our dedicated in-house specialist support service. At the ATO, we have a Thriving Minds strategy, which Megan's spoken about, led by a team of organisational psychologists. The Thriving Minds premise recognises the ATO commitment to promoting a mentally healthy workplace, and that everyone has a role to play in creating a safe work environment. One of the measures that Thriving Minds have implemented to address psychosocial risk is our Thrive at Work program, designed to empower staff by equipping them with tested, practical and innovative strategies to help them to thrive at work by implementing processes to manage role requirements and improve productivity. It's an e-learning product that covers 6 short modules, including thriving at work, having in place the controls necessary to balance work demands, deep work, creating time and space to tackle larger tasks needing focused concentration, mastering meetings, reducing back-to-back meetings leading to more effective and meaningful conversations, planning your workday, implementing time blocking to improve productivity, and shutting down your workday, establishing a routine to close out the day and assist with switching off after work. Thrive at Work was designed to be worked through either individually or collectively, with some of our teams building participation into regular team meetings. Working through the product together enables a positive message to be delivered to staff that the ATO value and support wellbeing. Where staff are struggling though, and a more tailored approach is required, additional support services are available, the most common of these being our EAP services for employees and managers. We have our EAP services contracted through TELUS Health, offering a free service that includes short-term, solution-focused confidential counselling and coaching to help promote useful strategies for better mental health. Alongside this, TELUS Health also provide a dedicated manager consultation service for people leaders. They can support and advise managers in dealing with complex people issues, preparing for and role-playing difficult conversations, debriefing from challenging interactions, or seeking support in their roles. TELUS Health also provide a dedicated hotline for transfer of employees experiencing suicidal ideation and crisis counselling available 24/7 for people experiencing a mental health emergency or at risk of immediate harm. But alongside this, the ATO have established an early treatment program to support staff who are struggling with their physical or mental health. We recognise that more intensive treatment is required, and we encourage them to seek support and guidance from their treating health team. In instances where the trigger for concern stems from the workplace, maybe a situation where a manager is dealing with a particularly demanding employee, or where a staff member has experienced a negative interaction either with a client or through an interaction in the workplace, we'll look to support the individual with a short series of treatment reimbursed through our early treatment program. Where identified as a matter suitable for this program, our rehabilitation case managers will discuss the situation with the employee, recommending ETP as a potential avenue for support. We encourage the employee to speak with their treating team, and if in agreement, will request their GP provide an initial referral and treatment plan to a provider of their choice. An expectation of the program is that the provider will issue a short report to Working Well, addressing the progress of treatment and any recommended actions that we can put in place as employer to better support recovery at work. Usually, matters managed under the ETP program are limited to 6 sessions with a psychologist, with updates provided after sessions 2 and 6. Where extension is required, we will consider up to 10 sessions to ensure complete recovery. Reimbursement of out-of-pocket costs for treatment are provided to the employee directly. Where appropriate, we may also consider short-term reimbursement of leave, with the option to recredit up to 5 days of personal leave. Last financial year, we had around 60 employees access this service at an average cost of just $600 per person. Another initiative that's been successful for the ATO is the Early Medical Management and Advice Program. Recognise the importance of the input of a treating doctor, we've made a commitment to initiate contact within 10 days of a claim being lodged. This is an approach we've carried into our health space as well, also seeking to make contact with treating doctors as early as possible in the case life cycle. With employee consent, a letter of introduction is sent to the treating doctor outlining the ATO's commitment to providing a safe and healthy workplace and in affording all reasonable steps and rehabilitation to support to enable employees to recover from injury or illness and return to work in a safe and timely manner. Correspondence outlines reasonable adjustments that can be accommodated and seeks recommendation regarding any additional assistance that may be required. The rehabilitation case manager will actively seek information regarding progress of treatment undertaken, likely prognosis, and impacts on recovery at work or return to work. Costs associated with this service and the provision of any subsequent reports are invoiced to the ATO. So far this year, we've utilised this service nearly 100 times at an average cost of around $200. Not much to keep the employee supported and encouraged to return to work as quickly as possible. I'm sure as many of you experience though, there are instances where treating doctors are reluctant to liaise directly with RCMs who represent the ATO as employer. So we've also established a panel of mental health providers to assist the ATO with management of complex matters. The ATO mental health specialists work in partnership with Thriving Minds and Working Well to support the design and delivery of mental health initiatives to support people to be their best and continue to thrive at work. Their services include assisting with the design and delivery of interventions to prevent harm and build psychologically safe and healthy workplaces, provision of advice regarding the management and support of staff across the employee lifecycle, peer-to-peer consultation with an employee's treating doctor to seek advice regarding management of mental health conditions within the workplace, and facilitation of wellness checks and assessments to support staff to recover at work, return to work, or to manage roles with a higher risk of psychological harm. One of the benefits of the in-house service is the availability of the specialist to assist with complex matters. With the in-house providers being clinically trained, we can facilitate quick referral of employees, ensuring access to support in a timely manner, assisting staff to address their work-related concerns promptly and minimising protracted absences from the workplace. There are instances where a single support session is all that's required to address concerns. However, the service can be used to support staff with a series of 2 or 3 sessions to work through coping strategies, boundary setting, or other control mechanisms to best manage the workplace situation. Another benefit of the in-house service is emergency independent assessment. Where required, we've been able to address concerns raised in as little as 2 hours, seeking proper assessment, facilitating conversations with treating doctors, and ensuring access to appropriate treatment all within the same day. So that's a quick overview of some of the ATO strategies in place that help target psychosocial risks. I am conscious of time, so I will go back to Megan for any final comments or observations.
Thanks, Christy. So as Christy touched on, like everyone, I'm sure, we have seen an increase in psychosocial incidents that are being lodged and keeping our teams very busy. We did expect this would happen, as I'm sure everyone did. Our staff now have more awareness and understanding of the importance of early reporting. But what is interesting for us is that many of these reports have gone on to become workers' compensation claims. And the numbers of our psychosocial compensation numbers have remained the same or even slightly reduced. So our wellbeing score from this year's census has also improved compared to last year. So we consider that all of these initiatives. So I don't think it's just one thing. I think it's a combination of a number of things have given us these good results that we're seeing today. So that's the end of our session. Thank you, everyone.
Terrific. Thanks for that session. And there was a lot of comment in the chat with a lot of interest in a range of different aspects of what you said. People obviously very keen to hear and find out more. One of the questions that came through is around how did you update what did you update around your mandatory training packages? And how did you discern what were the kind of key information to make mandatory?
In terms of what we make, sorry, I don't quite understand the second part of that question, but just in terms of the first part in relation to psychosocial specifically. So like I'm sure every organisation, we have mandatory training that covers quite a range of topics. And so that is reviewed, I think, every 12 months, and we have a look at what topics we should be covering. So we include in there about psychosocial health. We also have information in there for managers in terms of responsibilities under the Work Health and Safety Act and their role in relation to this. And we also have references, of course, to our own ATO tools in there. Christy, I don't know whether you wanted to add to that, but I think that's what we cover in a nutshell.
Yeah, no, very much, Megan. That is what we cover. And most of our changes that did happen with the legislative change was more around just expanding that content, just forming stronger linkages to the psychosocial hazards and more overtly calling out what those hazards look like.
Right. So we do have some more questions there that we'll see if we can got some space towards the end to put towards you guys. But we'll keep moving on because time's pressing upon us. So our next session, we've got Callie Barrett from the Department of Health and Aged Care. And Callie's a neurodivergent APS leader who champions inclusive work practices for neurodivergent staff. She educates leaders on fostering environments that help neurodivergent individuals thrive and leverage their diverse strengths for improved policy and program design and delivery. Callie's frequently called on to speak on neurodiversity and leadership, having presented alongside people like Hillary Clinton, Julia Gillard, and Lee Sales. And before joining Health and Aged Care, Callie's worked across a range of interesting and diverse roles in the community sector, across various governments and not-profits. Callie currently chairs the Health and Neurodiversity Network, is part of the APS-wide Neurodiversity Community of Practice, and advocated for inclusion of neurodiversity question in the APS census. She's passionate about making the Australian Public Service a leader in inclusive workplaces and has personal experience with disability both as an individual and a parent. And Callie's going to be discussing the importance of understanding, including and leveraging neurodiverse perspectives at work. She'll debunk some of the myths and share some of her lived experience and insights from working with hundreds of individuals working and living with neurodiversity. Callie's going to highlight how fostering neurodiversity at work can enhance workplace inclusion, productivity and innovation. So over to you, Callie.
Thanks so much, Andrew. Can everybody see and hear me and the slides okay? Excellent. Thank you. Okay, so I'm going to speed through some of the first ones. Often I give this presentation, and while I updated for today, I just wanted to make sure that I do have that acknowledgement. I am on beautiful Ngambri country. So I want to give my respect to any Aboriginal and Torres Strait Islander people on the call, as well as all elders past and present. Okay, so today we are going to go whistle-stop tours a little bit. I do speak fast. If you need me to slow down, please do let me know. So today we're going to cover neurodiversity versus neurodivergent or divergence. As we know, language matters. We will look at myths. We will look at the rather fabulous Endy Dandelion. It is not fabulous. I did it. If anybody's a designer, please do sing out. We'll look at some paradigms through which we can view neurodiversity. We're going to look at how workplace presentations may occur, along with neuro-inclusive practices, neuro-inclusive leadership, and then if we have time, we will have some questions. So before we get started, I want to be really clear. Today, I'm speaking as a person with lived experience, not a health professional. Really important. I work with the Department of Health and Aged Care, and it's really important that those two things aren't conflated. I am a person with lived experience, absolutely not a medical professional, and this is not a health specific presentation. Hence the fact it's not in our corporate colours. Now, since I was diagnosed with ADHD 3 years ago, age of 27, 42, I've spoken with thousands of people, and it literally says that up here. Like, I had a Not Fit for Work podcast for a little while, and it went global quite quickly. And as a result, I have spoken to lots and lots of people across the world. I've also spoken to hundreds, if not a couple of thousand people at various different summits and conferences. And so I don't just build the presentation around my own experience, although that is a focus. You'll see it is a little ADHD heavy, but I do try to give voice to some of those other stories that have been shared with me with permission and every time. Now, I won't go into too much on this because Andrew's already done a much better job, but I just wanted to be clear on that one. What I will say is I do take a very strengths-based approach to my own neurodivergence. I work in human-centered design and design thinking, and I've used that to really develop a lot of strategies for myself. That is not everybody's experience. So you may resonate with some of the things and not with others, and that's entirely okay. But if it does bring up anything for you today, reach out to the services you have available, your own networks, EAP, etc., so that you know, if there's anything that comes up, you're well looked after. You're always welcome to reach out to me on LinkedIn too. All right, so let's start with the meaty stuff. So is it neurodiverse or neurodivergent? So language does matter. And what I will say to you is neurodiversity was a term. It's not a medical term. It's an identity term. And it was coined by Australian sociologist Judy Singer back at the end of the 90s. And it was really an attempt to be an alternative to that deficit-based language. So we hear the word disorder a lot, obviously, attention deficit hyperactivity disorder. We have autism spectrum disorder. So it really was an attempt to move away from that deficit language. Basically, neurodivergent brains, they process information differently. So there is those things we consider the norms. I do this a lot. I will not apologize. I enjoy it. So we have those things that are considered to be norms, and a neurodivergent brain processes information differently. We may need to receive information differently. We may give information differently. And that is often, if you look at the WHO term of definition of disability, it is actually because of those social constructs that exist around us that something becomes disabling. If you have a mobility challenge, then if you aren't able to access a ramp, that becomes even more disabling than it might otherwise be. It's very similar for neurodivergence. If you're in an environment that requires you make eye contact, you focus entirely on this conversation and nothing else around you, that can be quite disabling if you have ADHD or other forms of attention challenge. Now, we're quite welcoming in the neurodivergent community. Neurodivergence may or may not be formally diagnosed. It can take a long time to get a diagnosis. It can be incredibly expensive. And so the data does show that the majority of people, and the data that I saw last, and I'm not giving the source because I want to check it and I didn't have chance again today, it was in the 90% range around people who seek a diagnosis. Ultimately end up with a formal diagnosis of either ADHD or autism at the time. Now that, as I say, that research was about 5 years old, so I'm looking for an updated source, and I'm very happy to share that once I do get that updated. My belief is that it's higher from what I've seen, but I want to validate that first. Now, although neurodiversity is used to describe a group of people, and usually used to describe a group of neurodivergent people, it's important to remember that neurodiversity is all brains, including those that we would call neurotypical. So neurodiversity is everyone, and we need to be very careful about not othering people in any type of diversity, because diversity means the entire range of existence. And neurotypical, it is one of those terms, again, used to describe people who do not identify with any form of neurodivergence. Okay, if I am going too fast, as I say, please do let me know. Now, I just wanted to touch on some of these myths, especially, you know, we've been having this conversation in the Neurodiversity Network Committee chat today, because we are looking at doing an activity for our formal launch soon. And almost every single one of these came up again, and most of them haven't seen this slide. So this everyone's getting diagnosed didn't happen when I was younger. We did some generational conversation in Natalie's talk earlier. I think Gen X got missed. We always do. But yeah, so this idea that it's the latest bandwagon, it's caused by TikTok, etc. I mean, it's not accurate. There is nothing to support that. What we are seeing is a generational catch-up. We've got several generations of people who were left behind. The DSM-5, which is the diagnostic manual that's used for psychological diagnoses, was 2013. That was the first time you could be diagnosed with with both ADHD and autism. You couldn't beforehand. You also couldn't be ADHD as an adult. So, you know, a lot of changes happen, which means we pay catch up. And so that's what we're seeing. We're seeing better education, more catch up, and better health literacy and mental health literacy, as Natalie talked about. The second one's my favourite. Aren't we all on the spectrum anyway? That's why it's called a spectrum. Absolutely not. No, it's not a spectrum with normal at one end and then autistic as ever at the other. That's just not how it works. It's a neurodivergence spectrum. So, and it's not linear. People go in and out as well. So it is important that we don't buy into that we're all on the spectrum. Some of these are just language. Oh my God, I'm so OCD. Okay, cool. Nice, cool story, bro. This idea about parenting, or that we can try harder, or, you know, all ADHDers are, etc., right? If you've met one neurodivergent person, you've met one neurodivergent person. It really is as simple as that. And then some of these other things around stereotypes. I am highly effective. I would be called high functioning. See what I mean? Lots. But that just means I have a really healthy dose of anxiety and some very well developed strategies that keep me on track. So everybody's presentation is different, as it is with anything else. And so it's really good to stay away from those generalizations. The last one, I think, is a bit of a sensitive one. So neurodiversity as a broad spectrum, neurodivergence is either a disability or a superpower. I would argue it's neither, and it's both, and it's everything in between, because everybody experiences it differently. There are days when I could not be happier about my brain. I love my brain. And there are days when I wish my brain would crawl out of my head and go sit in the corner with a dunce hat on. So it really is. There are times I don't do well with time. I can't stitch time together. For me, that is a bit of that's quite disabling. You know, but other things, I will solve any problem that people fail to solve. So for me, it's a bit of everything. Okay, so this was my dandelion that I made. Trying to show just how many different types of things can be included in neurodivergence. So you've got perimenopause, might be a bit of a surprise to people there. It is a change in the way the brain processes information. And so it can really, it's popping in. They're actually looking at the moment whether or not menopause fully falls under neurodivergence. Things like psychosis, bipolar, PDA up there is pathological demand avoidance. Things are changing all the time, and it's really important to remember neurodivergence is not a medical term. There's no hard and fast rules here. It is more an identity and a recognition of when your brain changes, and they can be temporary or permanent changes. You might find yourself sitting in the dandelion somewhere. Okay, paradigms. I wanted to talk about. I find this fascinating, and I initially saw this a few months ago from a person called the Lived Experience Educator. Their name is Sunny Jane Wise. I highly recommend following them on LinkedIn or any other form of social media. And I saw it and I immediately started researching. But the neurodiversity paradigm is that real recognition that all brains process information differently and require different conditions in which to do their best work. So that when we take a neurodiversity paradigm, we say, well, let's look at all those structural changes that we might be able to put in place without requiring an individual to do all the work. The pathology paradigm is very much about a disorder. You must be diagnosed with something for me to even give you the slightest little bit of adjustment or any kind of wriggle room within the expectations I have of you. The name was Sunny Jane Wise, and it's the Lived Experience Educator. Now, the pathology paradigm focuses on person-based deficits. So they have to do the effort. The individual has to do the work. They have to provide the evidence. They have to out themselves. They have to do all of the things in a workplace or in a school or with their friendship group even to be able to get adjustments and to those considerations. So there is a real issue around that pathology paradigm. And I think the neurodiversity paradigm has become something that, having seen the concept, is something that we're now trying to drive in the department through our neurodiversity network. And it's a really interesting something that I think a lot more work's going to come out of as we continue to progress and develop knowledge. Now, Andrew, I'm not too sure on the time. I've got a few slides to go. I know we're a bit behind, but I'm just going to keep powering ahead. Now, in a workplace, so there are lots and lots of ways that this can come up. So one thing we do know, for example, in neurodivergent brains, not in all, but it certainly seems to be a common thread, is around a dopamine deficit. So dopamine doesn't just, I mean, it's our reward center, but you also require a level of dopamine just to be able to stand up, get out of bed, to walk, you know, just to do those basic human activities. There's a level of dopamine that is actually used just to exist as a human. Now, when you're in a deficit, it can be hard just to get dressed, let alone do the boring work task. So in a workplace, you may find that your people with dopamine deficit may be focusing on the things that maybe aren't as important, but are more interesting. That can be something that really happens. There may be executive function challenges. I've mentioned time blindness. So for me, if I make a plan over here and someone says, will you do this in 3 weeks' time? I'm like, absolutely. I very much hope somebody is reminding me, because I will not tie those things together. We also have things like object permanence. So if a task goes out of my Outlook inbox, it no longer exists for me. So everything stays in my inbox until it's done. But that can affect people in different ways. Then this idea of attention deficit, actually, it's more attention on everything. What we know now in ADHD is that it's much more about, you can't filter your attention as well. So every noise, the electrical sounds of the lights, the people talking in the open plan office, you know, the work you're trying to do, the constant buzzes of messages that come up on Teams. If there's someone else behind you having a really fascinating conversation, and that's all at the same level. If it's within your hearing, generally, you can hear it, or you're seeing as well. And so it actually takes quite a level of effort just to direct your attention to the thing you should be staying focused on. So that it actually can become quite overwhelming. You see a lot of neurodivergent people have sensory issues or might go into overwhelm. So you have things like your noise cancelling headphones, etc. We'll have some strategies later. Ableism, why can't you just focus? I had a lovely chat with somebody who was like, look, I really want to help this person. They really struggle. They told me they've got ADHD. So what I'm going to do, I'm going to set them a bunch of alarms. I'm going to get them a calendar. I'm going to do, and I was like, I love that you are putting this effort in. That won't necessarily work, because those things, it's not about trying harder. It's not about setting an alarm or a reminder. It goes much deeper than that. It's much more complex. that said, we can multitask like a pro. I answered the question there that you saw about what was the name of that educator again, without even breaking stride as it popped up in the chat. You know, it's very easy for the multitasking. And the last one I will say about being easily distracted, you might say, you might do it yourself, right? But where you go, oh, squirrel. Please don't. It's actually, I find that it's a little bit offensive, to be fair. It really minimizes the experience. That can be quite traumatic when you know that you need to focus, but you're really struggling. All right, burnout. So this is a model that I got from I've got the references in there, but the model here, we've seen a lot of emerging research lately, and again, it's all linked, this will all be available, that neurodivergent people are more susceptible to workplace burnout. And for all of those things I've talked about, if you've got to put in so many more spoons, highly recommend Googling spoon theory, but if you've got to use so many more spoons just to be in the workplace, then you're using more of your personal resources just to meet the workplace without even doing the work itself. So it's important to remember neurodivergent people are often more susceptible to burnout, and when burnout hits, obviously it hits hard. So some neuro-inclusive practices. So really big important thing is know the people around you. So how do people work best? And you don't need to be a leader for that. If you know you sit next to somebody and every Tuesday they do a certain thing, then just let them get on and do that thing on a Tuesday. You know, if you know those people around you, then it's really part of, like, the relationships are almost the answer to every problem, relationships and communication. Be aware stigma and stereotypes still exist. They really do. I encounter them on a weekly basis. So even where people are, when you exist in like a really permissive or really inclusive or accepting environment, it can be quite a shock when you realize that that's not the case everywhere. You really don't have to be perfect. You just have to be kind. I used to be a police officer. I was told by my police sergeant when I was 19 years old, Callie, in life, just don't be a dickhead and you'll be fine. And literally, that is my enduring takeaway. If you spend your life thinking, okay, somebody's told me, pronouns is a perfect example, sidebar, side quest. If somebody tells you their pronouns, don't be a dickhead and not use them, you know, similar to with neurodivergence. If somebody is, you know, neurodivergent and they're like, hey, don't say the word squirrel, I don't like it, just don't be a dickhead. Generally that works. We talked about the social model of disability. Now, the curb-cut effect, things that support neurodivergent people or any other person who needs some sort of accommodation, generally work really well for everyone. Who doesn't like noise-cancelling headphones in an open plan office? Conscious of time, but this ick effect, if anybody's ever been on TikTok, the ick that everybody was talking about a year ago, it actually has been researched. There is a wonderful study, it's in the links at the end, whereby it was within, I think, 20 seconds of a neurotypical person meeting an autistic person, which is what it was, what the study focused on. They were like, I just don't like him. They just give him the ick. They don't know what it is, but they were just able to say, yeah, no, I wouldn't be friends with that person. Really quite strange, but the research is fascinating. Have a little look at it. Things that play into that, you know, eye contact can be challenging. We fidget a lot. We stim a lot. Now, stimming is a type of fidgeting. It can be verbal. When I'm at home on my own, I verbally stim quite a lot. It's a repetitive sound. Often we have a preference for direct communication that can be considered rude. There's a thing called rejection sensitive dysphoria. I don't really have time to go into that today, but again, something to Google if you're interested. And then emotional dysregulation is a real thing. And as an adult who experiences emotional dysregulation, nothing anyone says to you can make you feel worse than you already do, which then your RSD, so the rejection sensitive dysphoria, kicks in because you're like, just get over it. Why am I being so emotional? And it tends to spiral. Now, sensory overwhelm and masking. As I mentioned earlier, if you have to use your personal resources just to exist in a public space, open plan offices are a nightmare if there's not sufficient meeting rooms and everybody's on the same meeting around you. That is my personal nightmare. Masking is where people are acting like the people around them. I was 5 when I realized I was not normal, and that I wasn't very likable was the term. I remember thinking I'm not very likable. And I used to look at people around me who everybody did like, and I tried to be like them. And I did that all the way up until my 40s. So, that's what masking is, when you are putting on literally a mask of what you think you should look like and how you should behave. And it's hard work. So neuro-inclusive leadership strategies. I've really tried to group these around how we can do it. But the one I think is really important, where it all starts, is how we do recruitment. We tend to be real gotcha in recruitment, and we force people into an interview, even if it's not needed. They never need to speak to a person in their job, but we force them to be in an interview to check their fit. And, we don't give them questions up front all the time, or we give them up too much. Or I recently had a neuro-inclusive work interview process that was so much more work than a standard interview. So, really have a think about when we're recruiting, how we are recruiting. Reasonable adjustments and flexible work, those accommodations. People shouldn't have to work so hard to get a reasonable adjustment. And then look at how you're allocating work. Be explicit, give clear time frames, set deadlines. Not everybody wants things verbally, not everybody wants things in writing. So know the people that work with you and how they need to receive information. Check in. Some people need it. I get rage. Some people get rage where it's like you feel you're being micromanaged. Other people feel abandoned if they're not getting regular check-ins. All of these things work well for everyone. So you shouldn't need to know someone's diagnosed as a leader to be doing these sorts of activities. Okay, that is the very last one I have. I love this picture of the ant. So if there's any questions, if we have time, we may not, but back to you. Thank you, Andrew.
Callie, and thanks so much for such an engaging and insightful presentation. If you can see the reactions from the crowd, it's certainly overwhelmingly positive. There's a lot of engagement in the chat there. So I might just take one question because time is pressing upon us. I noticed that in the 2023 State of the Service report, it highlighted that almost 8% of the respondents identified as neurodiverse, and another 11% responded that they might be uncertain. And it highlights there might be a substantial part of our workforce that's not only neurodivergent, but even a larger portion that might be undiagnosed. And there was some conversation around the challenges of diagnosis and not diagnosis and the risks. I'm interested in your thoughts around some of the challenges for individuals and employers and co-workers where there's that uncertainty around neurodiversity.
Yeah, that is such a good question. So honestly, I feel like one of my greatest achievements has been helping get that question into the census. So that first year, yep, it was 8% and 11%. What we found when we were doing the ratification of the data was that 11% we had assumed, don't know, basically meant I think I am, but I haven't been formally diagnosed yet. We got some evidence back that suggested some people just didn't know what neurodiversity meant. So this year, we actually changed the question to have yes, no, don't know what neurodiversity means or neurodivergence means. And our stats now are much stronger. So there's been an increase almost universally across the APS in those people who identify as neurodivergent. What we see is the second a workplace becomes neuro-inclusive and senior leaders start talking about either being neurodivergent or talking about neurodivergence, then the rate goes up. So, for example, I know areas that this year went from 7%, their SCS started saying, hey, you know what? Neurodiversity is cool. Right, it was just talking about different things, and they went up to 30% in the next census. So, they're just having that safe environment really makes a difference. I will say, as a person who has probably done a little bit of pause to my career, shall we say, by being as open about my ADHD, there is definitely still stereotypes that exist. There is still the concern of if a position that I need to recruit for is a critical position that already holds a lot of risk Do I want to take an additional risk by having someone who might, I'm challenging my own stereotype, but also maybe they are going to get things in late. Maybe they are going to not turn up. Maybe they're not going to be good at communicating with the affected stakeholders. So, you know, it really, those sorts of things absolutely do exist still. And so it's important that people own their narrative and they're given the space to own their narrative. Hopefully that answered all the bits of that question.
That's great. Thanks, Callie. And as a fellow neurodivergent, I want to say thank you for bringing light to the issue and all of your work in the space. We may have some time for further questions towards the end. So moving on, we've now next got the ARC Laureate Fellow Professor Sharon Parker, who's the Director of the Centre for Transformative Work Design at the University. She's both a Fellow of the Australian Academy of Social Sciences, the Society for Industrial and Organisational Psychology, and having authored over 280 academic publications with almost 50,000 citations, she is ranked among the top 0.1% of global scholars in a field. She recently received both the Western Australia Premier's Scientist of the Year Award and the People's Choice Award. Among her other accolades, she was selected as Curtin University's Research Leader of the Year. Having worked with a wide range of public and private organisations, she is the founder of the Smart Work Design Model and co-founder of the Thrive at Work initiative, and has contributed to policy on work design in Australia and internationally. In this session, Sharon will be discussing and addressing psychosocial hazards and the hierarchy of controls through that smart work design approach. And she'll also highlight the importance of participatory change as a powerful pathway to successful smart work. So welcome, Sharon. It's great of you to be here. Thanks.
Thank you so much, Andrew. And if you can just confirm you can hear me, okay?
I can hear you perfectly. Thank you.
Perfect. Fantastic. Well, welcome everybody, and thanks for joining. I know you've had a long stretch, so hopefully you've still a little bit of attention left. What I'm going to do is I'm going to talk a little bit about the why of work design, the what of work design, and then the how of work design. And I am going to focus a little bit more on the how. So the first component will be relatively brief. So we're talking here about work design as a strategy, as an approach for addressing psychosocial hazards. So, of course, by definition, that means work design is an important contributor to people's mental health in the workplace. And so there's a sort of compliance imperative here to look at work design. But what I just want to make very clear is that there's a long history of research on work design spanning 100 years, in fact. And work design is very powerful also for motivation and performance, things like creativity, innovation. It's also really important for learning and growth. And of course, that's going to be incredibly important into the future with digital transformation and so on, because we're really going to need people to be constantly learning and upskilling. So why should we think about work design? Yes, mental health is a component, but it's also an important driver of very other critical behaviours in the workplace. What is work design? People struggle sometimes with this. So I'm going to give you an academic definition, and then I'm going to break it down and give you a couple of examples. So work design, this is my definition, the nature and organisation of work tasks, responsibilities, relationships, and decision-making in a role or set of roles. So it can be about work design for an individual job or for a group, a team. So let's try and unpack this definition a little bit. And the way that I would do that is to draw on a model of work design that I and colleagues have developed here called the SMART model of work design. I'm going to go through this fairly quickly. So what we know from, as I say, 100 years of research is that there is aspects of work that are psychologically important for people. And you can see some of those aspects indicated there. So we know, for example, that people like to have some variety in their work. People like to have control in their work. But it's a lot to think about this these different elements because there's more than 30 that have been identified as important. So what the SMART model does, and actually it says under review there, but this is a published paper, is we look at how these aspects cluster together. So first, an important part of healthy work design is that work should be stimulating. So have a bit of variety, use your skills, have a sense of meaning. A bit of challenge in work is actually extremely important. M in the model is for mastery, and this is about the importance of creating work where you know what it is that you're doing. So you have a sense of role clarity, you know what those tasks and responsibilities are in your job. You get some feedback on how you're doing. And it can really help if you're doing more of a whole job, because then you can see how your component fits into the bigger picture of the organisation. A is for agency, or sometimes we call it autonomy. And this is the fundamental importance of having work that you can control and influence and shape. And this is really stems back to a quite fundamental need that people have. A basic human need, in fact, is to be able to influence our world. And that applies at work as well. R is for relational work. This is the importance of connection, of contact, of support, being part of a team. All of these sorts of relational elements of work matter. And then T is sort of the big one, and this is the importance of having demands at work that are tolerable. And the demands differ according to what sort of job you're in. It can be workload, it might be emotional demands, and we heard Natalie and Christy talk about that earlier. It can be the number of hours you're working or other things. But whatever the demands are in your work, they need to be tolerable. And this is the SMART model of work design. So what you can be confident about is if you create these aspects of work for people, then you're actually going to be tackling most of the things that we know makes work healthy and high performing and productive. The slides will be available, so I'm going to go over this one quickly, but just to say, if you're more used to tackling this topic from the perspective of psychosocial hazards, the key psychosocial hazards that we talk about can all be mapped onto the work design model, but we are framing the work design more positively in terms of creating healthy work as opposed to eradicating psychosocial hazards. But of course, they are the same thing, just with slightly different framing. So let's give a quick example. This is a real example based on a lot of research that we've done in the aged care sector. So this is the components of work design that I've talked about. And here is a newly recruited aged care worker who's really stressed and planning to quit. And what might be the link of this with work design? Well, first of all, this person actually has some meaningful tasks. It's really meaningful to look after elderly people and a lot of variety that tick. But the person just simply has too many tasks to do in the time available. And many of the tasks are very emotionally demanding, as you can imagine, in this sector. What's more, this poor newly recruited person has not really had time to be properly trained in the tasks. So that's, if we use the SMART model, yes, the work is stimulating, but it's low in tolerability because it's got those high demands. And actually mastery is also going to be affected because people are not really understanding how to do the job effectively. We can then look at goals. Okay, this person knows what they need to do, but they've got too many goals and they do not know which they should prioritize given their limited time. Again, going to contribute to a lack of mastery. Let's have a look at decision making. This person can't influence the schedule, which creates some stresses with their outside life, and they can't influence change that's being implemented. So that would be an example of low agency. Relationships, because this newly recruited aged care worker is so busy, they don't have time to get to know their colleagues, which means they really find it hard to ask for help. So the relational aspects of the work are affected. And then finally, from that perspective of hours, you know, they're so under time pressure, they don't have time for a proper shift handover, which causes a lack of mastery. So if we were analysing this work according to the SMART model, we'd say that it's doing well on stimulating, but those other components, mastery, agency, relational, and tolerable, all have some significant areas that might need to be changed and redesigned. So how do we then redesign that work? Now, there's a lot of complexity here. We can look at creating leaders, and you heard that with Natalie and Christian there talk about development of leadership capability. We can look at things like activating job crafting. But what I would like to do is focus more on work redesign, as in how might you actually change the way that those tasks are organised, or what those tasks and responsibilities even are. So that's what I'm going to focus on. But what I want to highlight is the importance of involving workers in that process. In other words, if we, and we've done this, we're going to work with aged care people, staff, to improve their work design. We will involve the frontline staff in that process. So why do we do that? Well, it aligns with the legislative requirements. That's actually not why we do it, but just for noting, it is important to consult with workers from a legal perspective. We do it because it generates better solutions, because the people who do the work are the experts in that work. So if we want to actually create better quality work for aged care workers, we need to involve aged care workers as experts in that process. What's more, of course, we're going to come up with some solutions, and we want people to own those solutions. And what we know is that if we involve people in generating those solutions, they are going to want to see them happen. So as opposed to things being done to them, which then you've got this issue of how do we get, you know, acceptance to change, have them involved in and guiding the change, and then they have the ownership from the get-go. I would also just say that participation, the process of involving people in work redesign, is also protective in and of itself. So number one, it's stimulating because you get involved in problem solving. So people love that opportunity to actually try and come up with better ways to do their work. It builds mastery because usually in the process of doing the work redesign, you have to teach people about, if they don't already know, the bigger picture, constraints or challenges in the organisation. So that builds mastery. It actually increases autonomy because people are shaping the change. And finally, it really can help with that relational aspects of work, because you work as a team, and often you're bringing together people from perhaps different departments or different areas. So you're really building networks. And if anyone is interested, I've written a paper on this topic, and the paper is available and coming out in our book soon on this topic. So how do we then build this participation into the process of work redesign? Now, if you haven't gathered already, I like my little acronyms, and so I'm going to share with you a path to smart work design, but it's a path, as in like a pirate. So I'm going to share this process with you, and then I'm going to give you a couple of examples of how. Thank you for the person who smiled at that. Thank you so much. Right. So the first component is obviously to prepare, and this is not rocket science, but you might put together, for example, a little steering group, and ideally this group would include some workers or some representatives of whoever's work it is that you are redesigning. And of course, you set the scope of the project and you set the goals and you communicate, you do all the usual things that you would do in a change process. The second thing is assess. And this is the importance of taking stock and understanding what are the work design issues. Now, sometimes you might have already done the assess first and then you do the prepare, it doesn't really matter. But take stock, what are the work design issues? Because there's no point, I don't know, focusing on reducing demands if that is not the problem that people are mostly facing. So what are the issues? Of course, that data that you collect to diagnose the situation is also data that you can use later to to benchmark to see if what you have done has actually made things better. You then move on to this R phase that I call reflect. And I keep thinking, should I drop the R in my model, actually, this R. But what this is about, and I think it is important, it's about having collected all the data, done the assessment. It's about taking stock of the situation, making sense. Sometimes you get contradictory data. Sometimes it's different for different groups. So you've got to do a bit of sense making. What's really important is you feed back your assessment to the people that you collected the data from. And again, that's part of sense making, to check in, what do they think's going on? And at this point, you might be prioritizing as well. There might be many places that need work redesign, but where might you focus for the next phase? Because the next phase is when you get really into it and you work on the redesign. And what you're hoping to do, usually this is some workshops where you teach people about work design and you go through some activities. And it's usually a bit of a divergent process where you come up with lots of ideas, and then a convergent process where you try to settle in on a couple and you action plan. And now I've added this extra R. It's not in my original model if you read my paper, called realise. And that's because in a lot of our work, we've come to see that, of course, and you all know this, an action plan doesn't mean action, right? So there needs to be a sort of follow-up, you know, is it being implemented? What sort of accountability do we need to put in place to make sure it's implemented, to really realise those action plans? And then the last phase is track, which is really just say, okay, how's it going? Is there anything we need to change? And then what is the impact and what can we learn from this whole process? So, oh, sorry, I forgot H. H is habituate. So as you can see by this process, it's really focusing on a small number of areas usually. And then you might want to say, okay, but what about all the other people in the organisation? How might we spread it? Or how might we make sure that what we've done stays in place? So how might we sustain the change? And that's what the habituate phase is about. A very quick example. So this is a published study, rigorously evaluated. That's why I'm using it. Some colleagues in Sheffield looking at a call centre. So first of all, in this call centre case, in this situation, the unions were really strongly driving the need to improve the work design because of all sorts of issues of turnover and absenteeism. But the managers, the unions and the researchers in this case all worked together to prepare. They did the assessment, so they measured people's work designs, they measured people's performance, and they measured people's mental health and well-being. They fed the findings back to the workers, and they made the decision to prioritise in 4 of 12 teams. So they went with a pilot style of approach, which is often recommended, to focus on 4 particular teams. Then they did a series of workshops where they analysed the problems, generated solutions, came up with action plans, all that sort of stuff. Then there was a 4-month implementation phase. Then the impact was assessed, and then they expanded the intervention to other groups. And so just to give you a flavour, I'm not going to go into detail here, but just to give you a flavour, because I know that you'll ask otherwise, is what sort of things did they do? Well, the sort of things that they did is they increased call centre agents' responsibility for some of the admin tasks that had been previously carried out by the team leader, which made the work more stimulating. They improved the clarity about the performance criteria because it wasn't clear, and that was quite stressful to people because they're being evaluated on performance criteria that they didn't really understand. And they improved the feedback system, and that affected mastery. And then they also increased autonomy over break times. As you know, working in call centres can be pretty relentless. So they allowed the workers to choose their break times themselves, and they gave them more discretion over whether complaint emails should be passed on to the complaints unit. So those are just to give you a flavour of the sorts of changes, but and also to give you some examples of the impact. So by rigorously measuring autonomy before and after, they were able to show that there was an increase in autonomy and feedback in the 4 groups that had the intervention, but not the groups that didn't. So they had a sort of control group design. There was also in those intervention groups better well-being, a stronger sense that people's psychological contract was being fulfilled, and also the job performance, which was rated by supervisors, of people in the intervention group increased, and none of those changes happened in the control. So that's one example, and I just want to give you a very quick, conscious of time example of aged care, because I'm sort of wanting to loop back to the example I gave you earlier, because we do know that this is a sector where there are really some significant aged care. Yes, you can get the references. You can get them off the slide. So this is work led by Professor Daniela Andre here and some colleagues here at the Centre for Transformative Work Design. And this was some research funded by Safe Work, actually. So what happened? First of all, again, some preparation. Second, some assessment. And here, unsurprisingly, found very high levels of demand. And you can see an example quote there, not having time to take a lunch break. And 27% of staff that we surveyed had very high levels of psychological distress. Then there was, again, this reflection phase, just pausing. The decision was made to do some interventions in 2 of the sites, but also to have 2 similar sites as sort of control groups where, well, in theory, nothing was happening, but I'll come to that in a minute. Then there were a series of workshops, 6 workshops with the workers themselves, but involving, it was a representative model, so not all the workers, but representatives of the frontline workers. People got a bit of training and work design and analysis and so on and so forth. And then there was the implementation phase. And I put implemented during turbulent times. Pretty much every sort of change you can envisage in an organisation happened during the intervention period. Things like the CEO left, our main contact left, new technology was introduced, and so on and so forth. So very, very hard to get these sorts of change to get traction because of the incredible complexity of what's going on. But nevertheless, we managed and we assessed the impact, and habituate wasn't really a focus for this particular project. Again, quick example of some sorts of solutions. And this just really shows you, I think, how if you want to create mentally healthy work, you have to be a bit creative sometimes. So one of the things that was really, really critical for the workers was the onboarding experience, because there's a massive turnover, lots of new people coming in all the time, no time to train them properly. So they don't know what they're doing, which causes mistakes and causes stress for the people already working and so on. So there were a bunch of changes around improving the onboarding experience. And look, I won't actually go through all the other changes here, so I'll just flick on from them. But you can see, looking at things like handover processes, because when you look at when you ask the frontline, what are the challenges? These are the very practical things that often need to be shifted. What about impact? And again, quickly just showing you some results for the large site. We found a significant decrease in time pressure and emotional demands for the intervention sites, and not the same decrease in the comparison site. And you can see a quote there based on some interviews that we did. What's really interesting is we also used HR data to measure leave, and you can see what this purple is the intervention sites, and you can see that the personal leave hours are going down over time, but you can see for the comparison group, it's sort of staying constant. So we think that's to do with some of those interventions. And I will summarise super fast because I know we don't have long. What I've argued is that work design is a high level of control for psychosocial hazards, but it's a path to other great things as well. I've argued that the smart work design model can capture some of the key psychosocial hazards, but it's a nice, simple way of remembering lots of different components of work that are important. And then I've really said there's many paths to smart work, but I've suggested that this path model may be a useful process for thinking about how to redesign work. And that is it from me. So that was a pretty fast overview, but I hope that has at least stimulated some interest in this topic of work design, and always, of course, happy to have further conversations. Thank you, Andrew. Back to you.
Yeah, thanks, Sharon. And there's been a few questions come through. We had quite a few in the pre-registration as well. So I might throw one at you, which is around what lessons have you learned around the role of line managers, senior leaders, and HR in the work design process? And maybe talk maybe about the differences or synergies of those roles, you know?
Yes, because look, I think the thing is work design is a responsibility of multiple people, right? But the roles can be a bit different. Of course, managers play an absolutely critical role, and you can see that from the SMART model. If you've got a super controlling frontline supervisor who's really doesn't trust anyone, and so, that's going to affect people's autonomy. So leaders' behaviour, managers' behaviour makes a very big difference. But also, you can see that sometimes you have to make some more systemic changes. It's like, for example, changing the shift handover process is probably not something a frontline leader can do themselves. That's probably going to require, and the onboarding experience as given there, that's going to require probably some input from HR, probably some input from some other groups in the workplace as well. So I think the point is there are many paths to work design, and there are many people that can play a role. And probably what's important is sort of figuring out when you embark on the work design, how are you going to have all these different players? What components are they going to? What's the overarching strategy? And of course, workers themselves play a role too. Tolerable demands. Many of us are our own worst enemy, and we don't say no enough, for example. So we might need a bit of assertiveness training. So it's a multi-level strategy, I think, that can be worked out. But absolutely, leaders, frontline managers are key to this whole thing.
Terrific. Unfortunately, we've got so many questions, we just don't have the time to go through them. Even things that have obviously looping back to some of the other presentations around design and neurodiversity and some of the resources that are available. But so I'm going to have to park it there. And want to thank all of our presenters for joining us today. I hope the forum has provided you with some information and key insights and some really valuable takeaways. Feel free to put your inputs and takeaways into the poll or the chat. Throughout the session, we've posted a number of links to some useful resources that we spoke about today. We've also got a range of free online training, presentations and workshops that can be booked for in-house delivery. And you'll find all of those on Comcare's website, which we encourage you to visit. Your feedback is critically important to us. It shapes what we deliver in these events and how we deliver them. So your input provides the themes, the topics, and some of the questions that we put to the presenters, of course, and helps shape their presentations. There's a short evaluation survey. It literally only takes a minute or two that'll be sent to you, and there's a QR link that is already up there for you. So if you have the time and space, we'd encourage you to do it now, and you're not needing to take a quick comfort spot. So yeah, we really encourage you to provide us feedback, because it really makes a difference to help shape what it is that we do and deliver for you. Tell us what you want to hear more about and what topics of interest. Lastly, I mentioned at the beginning of the session that the session has been recorded, and we will post that on Comcare's website in the next week or so, along with presentation slides and any of the relevant resources, and we'll send out an email to let you know when that's up, so you can check out and share as you feel appropriate. In the meantime, thanks for joining us today. Keep well, stay safe, and hope that we'll see you next time.